Today, we're diving into a really powerful medical test, one that gives us a peek into how your body manages energy. I'm talking about the insulin in blood test. We're going to break down what it is, why your doctor might order one, and most importantly, what the results are actually telling you about your health.
But before we get into the nitty-gritty of the test, let's start with something simple. Think about the lunch you just had. How does that sandwich or solid turn into the fuel that's powering your brain right now? It feels automatic, doesn't it? But what's happening behind the scenes is actually pretty incredible.
Okay, so to really get how that process works, we need to meet the main character in this whole story. It's a hormone that's basically your body's master fuel manager, and its name is insulin.
So what is insulin really? Well, it's a hormone that your pancreas makes. But honestly, the best way to picture it is as a key. Think about it. After you eat, your blood gets a rush of sugar, or glucose, that's the technical term, and that's your body's #1 fuel source. Insulin is the key that literally unlocks the doors to your cells, letting all that good fuel get inside where it can be used for energy. No key, no entry. It's really that simple and that important.
All right, so when everything is running smoothly, this whole key and lock thing, it's not just a one-and-done deal. It's more like a perfectly timed dance between glucose and insulin.
Let's walk through exactly how this dance works. So, step 1, you eat. Simple enough. Step 2, that food breaks down into glucose and your blood sugar starts to rise. Your pancreas is like, okay, time to go, and it releases those insulin keys into your bloodstream. Step 4, the keys find the locks on your cells, pop them open, and the glucose rushes inside to be used as energy. And finally, as that sugar leaves your blood, your levels go back to normal, and the pancreas gets the signal to chill out and stop sending out so many keys. It's this beautiful, perfect feedback loop.
But what happens when the music stops? When that beautiful, delicate dance gets all out of whack? Well, that's when health problems can start to creep in. This is really the core issue we're talking about today.
And this really breaks down into two opposite problems. On one hand, you could have too much insulin. If your pancreas goes into overdrive, it can shove way too much sugar out of your blood. That leads to something called hypoglycemia. That's low blood sugar. And that's really dangerous because your brain is just starved for the fuel it needs to function. Then, on the flip side, you can have too little insulin, or the insulin you do have just isn't working right. In that case, the glucose gets stuck in your bloodstream. That's hyperglycemia, high blood sugar, and over time that can cause some serious damage.
And I want to be super clear about this. The danger of low blood sugar, that hypoglycemia we just talked about, is immediate. It's not something you mess with. If your glucose levels drop way too low, it's a serious medical situation that needs attention right away. We're talking confusion, seizures, you could even pass out.
Okay, so we've got a problem and we've got a prime suspect, insulin. But how do doctors figure out what's really going on inside your body? Well, that's where our detective comes in, the insulin test itself.
And here's the key takeaway. The #1 reason a doctor will order an insulin test is to investigate why someone keeps getting low blood sugar or hypoglycemia. If you're having these episodes over and over, doctors need to figure out, hey, is this happening because the body is just pumping out way too much insulin?
So what does that actually feel like? Well, the kinds of symptoms that would make a doctor think about this test are things like suddenly breaking out in a sweat, feeling all shaky and jittery, maybe confusion or dizziness. It's basically your body sending out a massive SOS signal that it's running on empty.
But that's not the whole story. There's another huge reason to do this test, and that's to check for something called insulin resistance. Now let's go back to our key and lock analogy. With insulin resistance, your pancreas is doing its job. It's making plenty of insulin keys. The problem is, the locks on your cells have gotten, kind of sticky or rusty. They just don't open up like they should, making it really hard for that glucose fuel to get inside.
So you might be wondering who's more likely to have this. Well, certain groups have a higher risk for insulin resistance. We're talking about people with prediabetes or type 2 diabetes, women with polycystic ovary syndrome, you'll often hear that called PCOS, and folks with heart disease. There's even a specific skin condition with dark velvety patches called acanthosis nigricans that can be a sign.
All right, so the test is done, the results are in. Now for the big finale. What do these numbers actually mean? How do we take this clue and figure out the full story of what's happening inside your body?
Now, this is probably the single most important thing to remember. An insulin test result never stands alone. It's just one piece of the puzzle. To really understand what's going on, a doctor will always look at it right alongside a blood glucose test. They're like a detective duo. You need both to solve the case.
And you can see exactly how that partnership works right here. Let's break it down. Scenario 1. Your insulin is high, but your blood glucose is normal or even high too. What does that tell us? It means your body is working overtime, pumping out extra insulin just to get through those sticky locks. That's a classic sign of insulin resistance. Okay, scenario 2. Your insulin is high or normal, but your blood glucose is low. That points right to hypoglycemia. Your body is releasing too much insulin. And finally, if your insulin is low while your glucose is high, well, that's a pretty clear sign the pancreas just isn't keeping up. It can't make enough insulin to get the job done.
So, when you step back and look at the whole picture, what's the big takeaway? The insulin test isn't just some random number on a lab report. It's really a window, a direct look into your body's energy balance, that whole delicate system that keeps everything running.
And that really brings us to the final and maybe most important point. Knowing how all this works means you can have smarter, more informed conversations with your doctor about your health. It all comes down to one simple, powerful question. What is your body trying to tell you?